If you want to check the occlusal, the craniofacial abnormalities, you do it here, because here they will all have a novojet. Oh, do like this. What's happened to your jaw?
Yeah.
It's back. Like this, stays here. If you do like this, it will come. So that's another gypsy technique. When they want to put defects on the animals, they always do like this and say, no, you see, that's a novojet. So you check it here.
Just before they had put the hot iron on it?
Okay, you can check it here. You can see the canines, a little bit of calculus. Same size, you see? The same size.
Yeah.
Look, I'm doing here, I'm with a lot of pressure, and he's not reacting. He's not like it, but he's not reacting like if I'm pressing.
Yeah. Will you always get some reaction though, like when you're pressing?
If it's not
Sharp,
painful,
it won't.
when we finish, we can try.
Okay.
Okay. And what I'm doing is checking if there is any sharp points, and there is a smell coming from his mouth. Just by the fact I did this.
You loosen something. Yeah.
From here, and check the smell.
Oh yeah.
Probably there is some diastema or things like this. This is the typical kind of animals that I have to be very conservative about the kind of treatment I'm going to do. You know, I don't want to create a painful situation in the mouth and not have a fat animal to don't eat for a couple of days. Okay?
Yeah, if he misses a meal, we're in trouble.
Yeah. Well, I'm leaving tomorrow, so. And of course, there's other things we can do. If I try to move the mandible laterally, there was not supposed to be any block. It's completely blocked on this side, but even more on the side that he's complaining. You see? And he's telling me that it's not comfortable. It's completely blocked here, you see? And this side, it's less blocked. And actually he's complaining this side. So probably here, it's sharper than in the other side.
Based on what we just learned this morning.
You can try it.
Here's a baby.
Do you see the difference? Let's take him in and try to take a look. Come back. No, bring both of them. So this is a complete independent system that will be structured. Yeah. Do not push. So basically the animal will stay with the head here, and if some I can regulate, and if there's no way to open except if I do this to the animal screen. Okay? When working in a place like this with such a small vent, it's important that there is something here. Because when they start fighting like this, if they fight, what can happen is that the back part goes here. And when they try to stand again, they can have a small machine. Okay? So, I don't find anything in the mouth. I can take it here, the lower end of the canine. See? Can you see? It's completely blocking and here is a line. You see? More here than here. So there is a consistency here. He's complaining more on this side, it's completely blocked, so it tells me that I must have extra care opening the mouth, and I will check, of course. I will check everything. What I do, easy. What I do usually when I put my hand inside, again, going back to the symmetry, I always do something like this. It's not the same doing this and this. By doing this, there's something like this, for example. I will feel it. Okay? You try. You do one side, another side, and now you do it with the fingers. Now like this. You do one here and one here. You see? It's much easier to identify variations on the occlusal surface by doing it at the same time. Yep. You leave the tandem here. Of course, in the end, what I do is 6 teeth, 5 interdental spaces. By counting them, I say 1, 2, 3, 4, 5. Is there any diastema or not? Is there any tooth moving? I always count it. I always count it. Especially because, as I told you yesterday, supernumerary teeth appear late in time. If you see this animal, for example, you can see that there was a diastema, a valve diastema. You see? So this typical cases you could open. Okay. We have done the extraction PT, we can see that. And in the others, I do the same. When I put my hand inside, what I do is I go on one side. Here is difficult to compare. I go on one side, I count, and the same here. By looking, there are no cheek teeth after the hard palate. If you see, the soft palate is here. If you see something where the soft palate is, that's probably a supernumerary distal molar. Sometimes people it's very difficult to count, especially in the back. That's why it's important to use the mirror, or at least count the interdental spaces. 6 teeth, 5 interdental spaces, okay? Remember what I told you yesterday about flushing the mouth of things. Some of them, they're really overrated, okay? Basically, if you think in the pharynx, we have the soft palate, we have the epiglottis, we have the entrance of the trachea, and the continuation of the soft palate is the palatopharyngeal arch. If by flushing in the mouth, they contract this part, they move rostral, the palatopharyngeal arch, and they completely block the trachea. And they really get scared about it. It's like, I'm drowning. So, as I told you, it's exactly the same reaction babies do when they are in the water. They block the entrance of the trachea to avoid the entrance of water to the lungs. So, I never flush these animals tied with the gag on. If we have that reaction, and some of them they start doing like this with their hands, just leave them go. Okay? We're going to try to flush and see if there is any reaction. Is there any antibodies? So what I do is I come from here and with my leg. Look, he's working the nostril. You see? Look his expression. It's not that marked, but he was blocking somehow. Okay, especially here. Some of them they block completely and they really stop breathing. You give them 10 seconds, and if it's not okay, you just do something like this. They will swallow, and they will release after a small massage. Good. Good. That's good. There we go. Even in horses, my opinion is that until this phase, you should not sedate the animal. Okay? Especially because we're doing clinical examination, the animal is getting used to be handled. Is more, of course, if it's a very nervous horse, probably that's something you have to think and to find a balance. Okay? But here, until now, it's very important that if you put the gag on, you remove this, because this can act, especially these halters with the nuts, they can be here and they can be pressing exactly the infraorbital nerve. Okay? And we can have temporary nerve paralysis because of the pressure. Okay? The lip commissure in donkeys is more rostral. The mouth of a horse should be here. This is more rostral. So when it's time to work with bits, if you see here, what I have is the canines. Okay? So sometimes we have problems and they learn how to pass the tongue. Let's try to put him inside and see how he reacts. No, okay. What I'm going to do, otherwise you say, okay, this guy is trying to do something, but now that I did it, he's going to close me inside. So, you lost 2 seconds, probably now, he will follow me without any problem. He realized that it's not a problem. Did you see what he tried to do when I stopped? Move the head down to try to sleep. This is their natural way. They can try to jump. Okay. They try that. It's not normal, they can try that. What I'm going to do now is I will remove the head cover. And I will try something to see how he gets. I'll just put this. No. him. Okay. I don't want to have this part interfering with the closing system of the gag, so it must be here. Still too big. Here. And usually donkeys are very good. As soon as you move the head up, they are very used to have the head resting. That's okay. That's okay. That's okay. That's okay. He tried once. It's not the end of the world. He see that he cannot do, and he stopped. Okay. Probably the way he's moving is telling me that I need to go a little bit up. While he's still moving the head like this, probably you do this to a horse that is not sedated, and I was already in the other room. What I'm going to do now is this. Just in case he got scared. You are going out. It's too big for you. I know. Come here. Did you see any extreme violent reaction that tells you that we need to sedate this animal for the moment? Well, the only thing I'm doing is desensitizing him. May I ask you not to touch him, to see his reaction? Good boy. He's scared. He is. I understand that. But he's trying to understand where he's coming. You know, and as soon as I don't leave him unattended with the gag on in between these metal bars that he had an accident, I think he will be okay. You want to see him change the attitude? As soon as I give him the chance to try to move the head down, you know, he's trying to go back. He's now looking for a way to escape, you see? But while the head is up, you see? While the head is up, he's like, I don't know what to do. You see the difference? I just need it. I know. That's okay. It's okay. You see, while we keep the head up, and it's always very difficult to show how things work when in a room, or if I was already with this animal, the teeth of this animal already done, and that's it. Those 5 to 10 minutes that I told you that I have his attention are starting to disappear. But anyway, for him, it was not the end of the road. He's not trying to escape. He was just not comfortable in there. That's okay. I can be inside. He can be outside, and that's it. I can be here. He can be there.
Some WD feeling.
And from here, I can completely control this animal. If I put the gag on now, I just have to be like this, and I can work. Okay, that's the nice thing of having something on the top. And even if he comes to me, or if he goes back, he goes left or right, the head is still in the same position, even if he moves the back like this. That's why with these head standers that are on the ground, you cannot do that. This is a great system, isn't it? So, sometimes, if I see that they are not reacting, I deal with them like this. What? Tell me. This? Okay. Did you see? This part here was touching, he was not comfortable. By the fact that I move it, he stopped reacting. So, I put this here, and the animal is telling me, look the expression. He's telling me he's not comfortable. You see? I put it here, and he's more relaxed. So it was going to be a factor of stress for me, just because I didn't pay attention to this small detail. Let's take a look at the pie. And look, because this is too big, here is not a problem, but if you come to sit this side, the halter is in the eye. Come and see. There's a shade in front of his left eye. So I need to try to find an equilibrium here. This is just too big, and that's it. Like this, check if it's not, it's very important that you check that it's not too tight, because when it's time to open the mouth, it can interfere with that. By doing things step by step, presenting things to the animal, he's comfortable with this. This gap that exists here is to put your fingers through the diastema, press the hard palates, and all animals will open the mouth. So by doing this, it's open, I just move it to the right place, and from here, I will adjust it. I must be sure that it's in place. Now I'll put this one here. I really don't like this hole. That's what we have. Come back. Come back. Come. Good. It's very difficult. It's very difficult sometimes to open the mouth. To open the mouth when it's going up. So I'll do one click and see his reaction. I'll do another one. I'll do another one. Good boy. Now do another one, and then move the head up. And I'm ready to take a look. You see, by keeping the head up, the animal is not reacting. There's nothing serious here except abnormal. Okay, a little bit more. There we go. He's sharp. Good boy. Don't touch him. He's very good. Don't touch him. Don't touch him again. Good boy. Ah, good boy. Good boy. Good boy. Okay. Easy. Okay. Okay. You don't like it? More comfort here. Perfect. You tell me. Good boy. Good boy. Okay. You want to take a closer look like you asked me to do? You see, this animal was telling me that he was not comfortable with the head really up. I reduce a little bit and he's comfortable. You see? He was just telling, probably because he's too fat and the pressure on the neck is not helping. So here, he's comfortable, you see? And that for me was not an overreaction. He was just telling me, hey guy, I'm not comfortable at all. You see? Want to come in and take a look? What I can see here, they're a little bit sharper on his right side than on the left, enough to block. So what I'm going to do is, when it's time to rasp, what I do is, I look, I start quadrant number 4, back, mandibular, turn to the right, mandible, turning up, maxilla, maxilla again. I check, if there's nothing to do, I close it. So usually in the back there's still some small points, so in that case I go back. If you realize the first thing I need to talk with you, I close the mouth. There's no point to be here. Even if the animal was sedated, I was giving pressure to the TMJ and I was somehow wasting, by putting pressure, wasting the sedation. I want the animal to be, and he's quiet. You see, I can be talking with you, the animal is quiet. And I gave him the chance, and I usually do this, I don't start working because, like I did it twice, I give him the chance to understand that when I'm going to open the mouth now, it's not dangerous. And that for me is not wasting time. That for me is winning time, because next time a dentist will check in this animal, if people do things right, the animal will tolerate. And of course my hand is here, not because I'm resting on him, but because I want to avoid an accident with this animal touching the metal bars. And these are the small details. And for example, now, let's try something different. Gag and engine. And he's not reacting at all. You see? He already understood that the gag is not a problem. He already understood that the engine is not a problem. And when I'll start rasping, the first thing I'm going to do, I will touch with a rasp in the gag. Because this is complete, the heads are empty. So this is a percussion, the percussion here is very high. Easy point. So I'm worried because I'm on the wrong side with the equipment. I think this animal is complaining from the neck, not from the mouth. Because the root cause I'm telling you. All the teeth that are removed is here. Why? To keep this mouth open when I have to stop and clean it. It's not effective anymore. Still with us. Is there any brush? The friend is coming. The friend is coming. I rest 90%. I still have to rest. The lower levels a little bit in the back, and just be sure that everything is right. You know, because it goes really fast, and as soon as you see, now we're ready to start. There's no point to be resting. It was. Lower levels, one, right? There we go. So high feeling. Oh, myself. Last one. Let's try something. Next year I'll bring a good system and I give it to you. It's always the same. Listen. Close the size of the clock. See? See? Remember there was a painful reaction? Look. I'm really pushing. There's no reaction. If there was an ulcer in there, he was still complaining because I was pushing the ulcer. There was no ulcer. You all see this. I'm really pushing. Here he was complaining. Here he was complaining. It's not. I just eliminate all the teeth are here and there. If you do it fast, very carefully different from the lady says, fast and accurate. That's why I'm watching. That's why what I'm doing. And basically, what I did, like this, like a 10, I did 10, 9, 8, 7, 6. 10, 9, 8, 7, 6. 11, 11. My hand is not even moving, I'm doing this. Turn it up. 11, 10, 9, 8, 6. The nice thing of being around is this. It doesn't have to go like this, or it go like this. So you go in, you do 11, and while you're coming out, you're turning it. And you do until the 6. You go to the other side and you do the same. It can take us this. Sometimes you have to like pretend that you use something else because sometimes owners don't understand that in 2 minutes it's done. Especially in animals that you visit every 6 months or every year. The really nice aspect of dentists, for me what he was doing, he was telling that he was not comfortable. It was nothing related. It was not when I was resting that he was overreacting. It was when I tried to keep the head up. We all understand that here, fat can be also painful, okay? The nice thing about dentists, especially when you work, for example, in places like Mexico or in any of these projects, sometimes you have people riding their horses or dentists, especially dentists, 4 or 5 hours to reach a place. This is great. You open the mouth and say to the owner, there's nothing to do your animal, you can go back. If you sedate the animal, and that man was the last one to arrive at noon, and suddenly it's 5 p.m. and he still has to go home another 5 hours, that's a problem. And with this, at least you don't have these problems. Did you see the difference in reaction? Did you see the difference in sound? Yeah? Because it was before, when touching, the glove is open. Both sides. See? It's completely locked, and now it's not. Of course, you need to get used how to work with the tools. Sometimes people, they try to rasp slowly. It gets covered with dust, it's not efficient, you are overheating the teeth. And that's also a problem. That's why I'm always pulling the equipment. If I need to rasp, of course it was a very simple case just to remove the sharp edges. But if I have to remove, for example, a focal overgrowth, I will put the rasp in the water to be cold so you can reduce it. By reducing the temperature of the disc, you avoid burning the teeth. You are a good boy. Wanna go home? You go home. Look, and down. Let's go. We just did something there, and I want you to see, because while the animal was resting on me, I took his eyes, and as soon as I took him here, look how he changed his expression. This is the limit, and this was something I should do before in a fact animal. Test the limit of his neck. Look, here, he's more than comfortable, see? He's not complaining at all. As soon as I move 5 centimeters or 10, he starts telling you that he's not feeling. So, actually, the overreaction he had was nothing related with the gag. All the time was pain in the neck. And I think it happened because we gave him those 5 minutes the chance to understand that engine, gag, strange noises were not a problem. If you work with donkeys, my advice is that you give them the time to understand, because even if it's the first time, it will take a little bit longer. The following times will be quicker and quicker. Apart from, of course, all the parts of drugs. But if you don't feel comfortable, if this animal was doing something like he was doing, and then it was related, and I need to do things, I will stop. I will sedate. You finish the work. And if you don't feel comfortable at all, you sedate when you should sedate, after the clinical examination, after obtaining the information. You didn't see that he's not complaining when we wrote before. And is able to eat now.
Oh yeah, this foot is not easy.
You don't see me panicking when this animal did this twice. I just stop. For me, first, because it's not wet, it's not anxious. If it was wet, it would be really anxious. The animal doing this. Second, the gag was closed, or the time he tried to do this with the open mouth, I was here with my hand on the rope. If something goes wrong, I will pull and the animal is released. And the animal was telling me that the gag, the noise, being inside the mouth was not the cause of the problem. So just by moving the hand down, the animal came back to me. Of course, I can work. That's why working with this is so nice, and don't have to work with a drill. Because with the drill, I need to be this, working with both hands, and I could not keep the head. So like with this, I'm working. See? Can you see? It's completely blocking and he doesn't like. You see? More here than here.